Hi, and welcome back to part one of lecture one for module number 4, Introduction to Community Health. Last time we were talking about types of emergencies, traumas and disease outbreaks, natural disasters, complex emergencies, and all kinds of different types of emergencies, a general overview. Now we'll be talking more about management. We saw the Doctors Without Borders video in your homework for the week, and that was more about an international aid organization that does emergency health in complex emergencies, particularly. Now we'll talk a little bit about the Federal Emergency Management Agency, which is a United States national level agency that coordinates the response in emergencies in the United States. Basically, for larger level emergencies, they use the incident command system as well, the one that you saw in the Salvation Army video. So if you haven't seen that yet, check it out, and it gives you an idea of how this whole chain of command works and how the response can be coordinated by making sure people know who's in charge and what to do and who to report to and things like that. So FEMA, in a nutshell, calls for a whole community approach. They include all levels of government in the response. So part of their incident command system, I haven't looked into it myself as much, but it involves how to deal with other levels of government. Also, they interface with non-governmental organizations, community-based organizations when they're doing their responses, and private sector organizations. And their goal, it may not always happen because the nature of emergency response is sometimes chaotic, most of the time. And as you who are emergency responders know, that the first priority is usually rescue and saving lives, and all this coordination is hopefully to keep things organized during that process. So they want their solutions to be informed by the community and utilizing diverse knowledge of both the community and private sector businesses, local companies and stores and organizations in the area of the emergency. So they're going for a whole community approach using, they even coordinate through with the transportation sectors, healthcare, schools, public works, communications, agriculture, chemical, and nuclear departments, and more. There's more about FEMA on this website, and I'm sure you've heard of their recent responses with Puerto Rico and a few years back for Hurricane Katrina, and just how sometimes the incident command chain or the protocol may fall apart, or sometimes it doesn't apply. And those are things that we can learn about through mistakes in emergency response, through jobs well done. So that's important to look at those emergencies that were responded to well and not well. So you usually hear of preparedness and response all in one breath, but we'll break down emergency preparedness first, which is planning to manage an entire life cycle of an emergency. This means establishing priorities, identifying levels of capacity and gaps, and providing standards for assessing the capabilities, because often if we just look at capabilities and there's no standards, we won't have a way of knowing what is actually possible in a response. So this preparedness protocol generally would help civil society and other entities learning their roles, how groups like the Medical Reserve Corps, which is a group of volunteers, skilled volunteers, who are ready to help. And so preparedness is knowing what these groups can do and who's out there and how to and what they plan to do and how to coordinate everything. So DHS has more Homeland Security about this. And I guess the main goal of preparedness is to organize all the parties involved to coordinate the response. So response is defined by FEMA as a continuous cycle of planning, organizing, training, equipping, exercising, evaluating, and taking corrective action in an effort to ensure effective coordination during incident response. There is a National Response Framework, NRF, which is used in the United States, including all kinds of organizations. It's actually a huge list. I put a few here: transportation, communication, engineering, forest service, mass care, emergency assistance, temporary housing, human services, logistics, health, medical service, search and rescue. So these are just a few, but there's a bigger list over here that's in the National Response Framework. So WHO, World Health Organization, and other organizations set international response guidelines. So those are the federal United States, but there are other ones for on an international level, on a, in different countries. So there are also incident command systems and emergency protocols that differ maybe a little or significantly from our Homeland Security system. So that would be interesting to look into further as well if you have the interest. Incident command systems. So we have the video from Salvation Army, which basically establishes, as you saw, a structure of how there's a sort of person in charge, then there's people who report to them, who report to them, and it goes down the list, and that's basically your incident command chain. And so the purpose of these systems is, again, a coordinated response. And this identifies basically the hierarchy for instructions, for protocols. It's also important if two people are differing on a important decision that's urgent, then the ICS will say, well, technically he's higher on the chain or she's higher on the chain. She has to make the decision. So it helps reduce personal differences and conflict as well at a time of urgency. So according to the organization and emergency protocol, there might be different ICS systems. It might be different in a hospital. It might be different in a company, a school, in the government. So many organizations, especially hospitals, will have incident command protocols and systems, just to manage emergencies the best way that they can, because at the time of the emergency it's just chaos. So that was basically an overview of emergencies. It's a very complicated issue with so much to say about emergencies. We'll be having a disaster preparedness and response course through Community Health Bachelor's Program. So look out for that next year. So this is just the tip of the iceberg, if that. Oh, sorry about that. So community resilience. Resilience has been defined by Thornley et al., your reading, as the capacity of people, communities, and societies to prevent, respond to, and recover from the consequences of a disaster. They're focusing on strength and vulnerability factors at the individual, community, and societal levels, which interact to influence the overall outcomes. There are distinct community level factors such as collective efficacy, and we'll look into that on the next slide. So looking at these different factors, for on the person level, the strengths are self-efficacy, coherence, hardiness, and the vulnerabilities on that level are prior trauma, low support, learned helplessness. For community, it's cohesion, collective efficacy, and for community, it's also conflict and fragmentation. For societal resilience factors, it's empowerment, duty of care, crisis procedures, trust. And for the vulnerability of societies, it would be blame attribution and inappropriate crisis procedures. So often, what's interesting is how these two strength and resilience factors relate to the prevention, response, and recovery of an emergency, and how the risk that the risk that's there either causes loss and distress, adaptation and growth, but most of the time both. There's a lot of loss, there's a lot of destruction, and there's also a significant amount of resiliency in the way of adaptation and growth. So the earthquakes were 5 consecutive earthquakes and aftershocks in less than 2 years. Loss of 185 lives. It was an unprecedented damage and destruction in that area. And so the questions that Thornley et al. Wanted to know were how community responses were to the earthquakes, and describing the effects of community responses on well-being, identifying factors that affected community resilience, and providing recommendations for future actions to support resilience of a community. And if you look deeper into these questions, examining the responses, we saw out of 6 neighborhoods in the paper, the few with social connectedness, a strong sense of either a tribal community or neighborhood community, were able to respond faster. Well-being, people who had survival skills, both physically and mentally, were able to cope with the emergency in terms of well-being. Factors that influence community resilience were, as they said, connectedness, but also infrastructure and how communities made sure that their infrastructure is okay and functioning before the emergency. Just regular maintenance in that sense, because they didn't see it coming. And then recommendations. So what did Thornley et al. Recommend for communities to do? What would you recommend? And so that's what your prompt is about, is kind of using your expertise of your life experience of your time as a medical provider, if you've done that, or any skills you have to discuss how to build community resilience in your own neighborhood. How might you do that? You can take a particular example of one outbreak or one disease or one event, hurricane, or you can talk generally if you want to. And your reply is talking about your own definition, so you don't have to use Thornley's. You can talk about your own definition of community resilience.